This is the peakcast presented by Strive 365, where we strive to eliminate childhood trauma while equipping youth to become resilient and better our community. We discuss social and emotional issues affecting today's time while bringing you experienced leaders to discuss diverse topics in a fun and informative way.
Excited to have you guys back for another episode of the peakcast, here with my amazing co-host once again, the great John Paul. Excited to share our guest today, Dr. John Meurer. He has requested that I do not call him Dr. Meurer that much. However, we will probably sometimes do it, but we'll refer to him as John this time, as we all are professionals, but we're also human beings and people who like to go by our first names. So, JP, if you want to introduce our guest and talk about a little bit about your week, how's it been?
Yeah, my week's good. We've been busy. So, we're really glad John can join us. Man, Hassan, like you said, I'm so used to calling professionals Dr. Meurer, but it's going to be tough. So, John, welcome to our peakcast. Tell us a little bit about yourself, who you are, and what you do.
Hassan, JP, and folks listening in, it's a real honor, privilege to participate in the peakcast. I'm a pediatrician and a community health professor. I direct the Institute for Health and Equity at the Medical College of Wisconsin, where I've been a faculty member for 26 years. And my passion is kids and youth. I've taken a particular interest the last several years in trauma-informed care, doing community-engaged research focused on early child developmental systems and how we improve them. For example, the developmental screening pediatricians do, and the important community connections to birth to 3 and therapy services, and really thinking about what families need to cope with stress in life. And I've really enjoyed in the past year designing and now implementing an evaluation of Peak Team, which is an extraordinary approach to using kind of sports, but a lot of other evidence-based approaches to addressing trauma for youth in school settings. And right now our project is focusing on a wonderful partnership at Milwaukee Academy of Science.
And can you kind of touch on, I really like your resume as well. And it looks like you have been to Wisconsin, Madison, also Marquette, and it looks like you were at Baylor doing your residency as well. Can you kind of touch on why you wanted to come back? You did your residency in Baylor, which is in Texas. However, you ended up coming back to Wisconsin. What's your passion in staying in Wisconsin, and kind of touch on why you love it here?
Yeah, well, thanks. My wife and I spent some time after my training and her residency. She's a family doctor in Minneapolis. She was getting a master's of public health degree, and I was kind of a trailing spouse doing really fun stuff at Park Nicollet Medical Center and the Institute for Clinical System Integration. And we had a son. And we loved being close to friends locally, but our families were distant in the Milwaukee area and Detroit metropolitan area. So we really wanted to get close to family. And so that brought me back to my hometown in Milwaukee. And my wife has really enjoyed this community. And so we've been at the same place of employment, Medical College of Wisconsin, for 26 years. We have 3 adult kids who we're quite proud of what they're doing and their relationships. And it's been really fulfilling.
And Milwaukee, I know, appreciates you a lot, especially us here at Strive. So really happy to have you here in Milwaukee. So thank you.
Yeah, and I hope the audience got to know you a little bit more, John. So we like to do this, put you in this type of scenario. It's called the facelifts. And so, John, when have you, in a situation, fostered resilience, acted with empathy, cultivated change, established trust, or served youth in the past couple weeks?
Yeah, those are wonderful skills and kinds of characteristics of people that we cherish as values, those COPE approaches. And particularly now with the stresses of COVID and people needing to cope and adapt to a new normal, the economic recession that's particularly hitting Black and brown people and people in poverty, rural communities across our country and the world. And also the call for anti-racism, COVID displaying the inequities in our systems and healthcare, and being very purposeful in trying to address that on a personal level, but also on an institutional and a system level, that Black Lives Matter. So all of those in my work, whether that's research, education, community engagement, patient care, administrative leadership, those are all really important skills. And I cherish that my collaborators and partners at MCW and in the community have shared values, and we're working together to address some of these amazing challenges.
Awesome. Yeah, especially you touch on the world we're living in right now. Change, it's needed. And a lot of people look at it and they fear change and they don't want to be a part of it. But we really applaud you for jumping into that and also making sure that the people that you work with are also on the same page as you. And that's important right now, especially in today's day. We all just have to accept that we have to do better as a community, as a nation, together. And that's the main thing. If we work together, we can achieve anything.
Excellent.
So Dr. Meurer, or John, I'm sorry, I'm going to get used to it. By the end of it, I will be used to it. So John, Strive 365 and MCW are working on a very unique project. I don't even know if project is the right word, and I'm going to have you elaborate on it. When I heard of the IRB, I used to always just be like, what is IRB? What is IRB? So I'd do my own little research, trying to understand it. But learning it from you, Paula, JP, and Brandon, it's been something that I've been very fascinated to learn more about. And I think the audience would love to hear more about what is an IRB. And especially, can you talk a little bit about our IRB and what's the purpose of a research evaluation based evidence?
Yeah. Well, an IRB is an institutional review board, and every academic institution and research enterprise that does research, that does systematic approaches and generalizing what we learn to others, needs to abide by the ethics of conducting research to protect the privacy and confidentiality of the participants. So an IRB is really a committee, and the Medical College of Wisconsin has a committee and other academic institutions. And we apply research ethics when they're reviewing the methods, the approach we want to take, the surveys we want to do, the focus groups with teachers, to ensure that we're protecting the participants and things that are important to them, and respecting their autonomy, and letting them decide what they want to participate in and what they want to share. So the Medical College of Wisconsin is assisting Strive 365 in a research evaluation of Peak Team, of this innovative approach to addressing trauma for youth in school settings. And we're doing it with wonderful partners at Milwaukee Academy of Science. And the purpose of Peak Team is to reduce the impact of trauma and toxic stress on youth in Milwaukee. So we want to look at the youth who are exposed to the program and some similar ones who are not, to see if over time the Peak Team has an impact on their knowledge of what to do about trauma, on their attitudes that they can do something about it and behave in a different way, and their actions. It's a pilot project study, and we're just getting started with the survey part of the work.
That's exciting. And speaking from being a coach and in the trenches, working with the students themselves, you know, I have seen, it's not like a one type of solution where, you know, you give them the curriculum and they learn right away, but you see small progressions every day when you see them. And I think one of the key things is building relationships with those students so they learn how to trust you, and, you know, they'll be willing to more learn about the curriculum of craft and what Peak Team does. So it's exciting. I'm looking forward to what's to come at the end of all of this research. I know you cover some of it, but are there any specific objectives for this research evaluations that we're targeting?
Yeah, we at the Medical College of Wisconsin have worked closely with Strive 365 and Milwaukee Academy of Science in developing our evaluation approach. So we're going to be using surveys with youth and focus groups with teachers, and together trying to come to an understanding what works. So the surveys are going to occur starting this month, here October, and then we're going to repeat them again with the same group of students in January, and then again in April. And JP, as you mentioned, you build trust in relationships, you share information, and hopefully you start to see folks incorporate that in their schoolwork, in their interactions with peers, in their lives. So we're going to interact with the student scholars. And I like that MAS calls their students scholars. It starts to help them say, wow, you know, I'm discovering, and I'm going to aspire to important activities after I finish my high school diploma. So we want to assess the impact that the Peak Team curriculum has on 8 outcomes. So we have these kind of domains, and we have validated questions under each of those to understand the experiences of the youth who respond. We want to know subjectively from their own experience their well-being. Are they feeling really happy and successful and proud, or are they struggling? What's their sense of purpose and optimism? That mindset is a really important part of making progress individually and interrelationships with others, and how they cope and make decisions and take responsibility for their actions and the consequences. We want to understand their emotional self-awareness, because some kids might, because of their experiences, have triggers that really bring out anger and frustration. And how do they try to contain that and learn new mechanisms that are healthier for their interactions with others and make them feel better? So that leads us to think about anger management and emotional self-regulation, about their skills and relationships with peers, with people older and younger, with their parents, with people in the community. And frankly, have they had any challenges where they've been called out for misbehavior and disciplinary action in school? And that's all by self-report. They have to feel comfortable sharing the truth with us. And then we realized in this special time, we wanted to understand what they're doing about COVID, what protections, how they're experiencing the stresses of this pandemic, and also a little screener on their mood. Are they depressed? Are they anxious? Because we can also monitor over time that context of what's happening with COVID and also what's happening with Peak Team for the participants. So that's the surveys of youth. And then simultaneously, we're doing focus groups. We did one in the spring with teachers to guide improvements of Peak Team this year. We're going to do another in November. We'll have the insights of what the students are saying, February, and then maybe in June. And that'll involve coaches, teachers, the so-called cultural team staff at Milwaukee Academy of Sciences, about the Peak Team program, their observations of the students. So we go beyond surveys to what are the teachers seeing among the group of students? Do they have stories to tell anonymously and confidentially that complement and then validate our survey findings, and very importantly, guide our ongoing improvement of the Peak Team program?
Awesome. That's it's really interesting to know how deep the IRB is actually going into. A lot of people can't even wrap their head around that. So I give you guys a lot of credit for not only understanding it, but also being able to implement it and make a difference.
Yeah. So the IRB ensured when we designed this approach, they looked at the consent forms or the information letter, the survey instrument, that we're going to be protecting the privacy and confidentiality, the volunteerism involved in this kind of project, whether it's students or even teachers. We have a research team that's actually doing the work, and that's a partnership of Strive, Milwaukee Academy of Science, and the Medical College of Wisconsin. So it's really the research team that's implementing the study, and then we'll analyze the results when they become available. And the IRB will ensure that everything we do is of high ethical standards.
Beautiful. Three words that I'm going to throw out. These are three words that I think are so important, and they're major factors and aspects to what we're doing with the IRB. Unity, community, and collaboration. Just kind of tell me what those words mean to you, but can you talk about, you kind of touched on it a little bit as well, with the the institutions that are involved with MAS, MCW, and then obviously Strive. Can you talk about who all is involved in this process? Because it seems like it takes a lot of individuals and a lot of resources and a lot of things to work. Can you just touch first on the short-term basis of what parties are involved and how important their collaboration is?
Sure. So, for Unity is working as one. And the community we're focused on are the youth and families at this school, but they're in that context of particularly being African American Black families on the north side of the city of Milwaukee. So that important context and community. And the collaboration means working with community, with parents and students. So we have several people at Strive 365, folks like you, at the Medical College and our Institute for Health and Equity, and at Milwaukee Academy of Science. We all have different primary purposes, but together, what do we have in common related to making Peak Team work well and assessing what works and how to make it better. And we even drew in a few consultants. So we have some external experts looking at what we plan to do to minimize any kind of biases or limitations in our approach. The focus groups involve the staff. So that means they have to have time for an hour to share with us. And we did one in the spring to think about the strengths of Peak Team and the opportunities to do it better. And we also, right now, are asking the parents of several hundred youth to review the actual research plan. Simplified, because they don't have the time to read a multi-page document. But the survey tool, and do they have concerns about any items in the survey where they don't want their kids to share about misbehaviors they've had or how they're feeling? And when the kids fill out the survey, that actually might raise the parents' awareness of something they didn't know about. That gets a dialogue that we think is a really healthy process. But of course, if there's serious concerns, then we have psychologists at Milwaukee Academy of Science to respond to those youth promptly if there are really serious issues. So we start with the school, we go to the parents, and then the next stage is to the youth, the students. And back to your point about trust, they trust the teachers, they know the teachers. So the way we get the survey to the youth, to the scholars, is through the teachers. And they explain to them in their own way why, the value of doing it, what's going to be on it, that they can get some help from the parents, but we really want to hear from them firsthand. And that parents can make a choice to say, I don't want you to do this, or I want you to skip those items. And that's perfectly okay. So the scholars will also read an information letter at their reading level. We're working with 3rd through 7th graders, and complete the survey. And then when the survey is done, a few weeks later, the biostatisticians analyze the data, generate reports. I'll summarize the findings as a group. We'll never report anything about an individual child, all anonymous. That's a really important protection. And we'll share that with the leaders at Milwaukee Academy of Science. It's their students, with the staff who really care a lot about them, the teachers and principals, with the parents of those youth, and then eventually to the youth themselves. What do they think? Is it what they expected? What are the implications of what we learned? What might we do differently in Peak Team at the school, etc.? So we're hopeful that this really sheds some useful light on what's happening, the experiences of youth, and guide not only Peak Team, but activities at the school and in the community and within the families who are our partners.
Awesome. And I guess that really covers that long-term process as well. And so what kind of resources do community, unity or collaboration, what kind of resources do we need or someone needs to be in order to be successful, and if they want to do IRB,
Yeah,
need to be involved?
Well, for a research project, and this one in particular, we're very grateful to a foundation, a philanthropy. The Al Hervis Adam Education Foundation provided important support for both the peak team operations and the evaluation by the Medical College of Wisconsin, and Strive 365 making investments as well. Folks like you helping with program and development and raising awareness through communication. So it's a partnership, Strive, MCW, Milwaukee Academy of Science. It requires staff and parents and scholars. All of them are really essential for a successful program and evaluation.
And I kind of just want to add a little bit to that. When you're doing an IRB, when you think about it, each one, does it just depend on how large the community is, or based on what your target is? Is that kind of how you assess what resources you're going to need, or is each one very similar?
No, there's wide variations. There's many different approaches to research. We're using surveys and focus groups as the tools, but of course at the medical college we have clinical trials where we give a new medicine or a new surgical approach to some, and we might have a flip of the coin, a randomized controlled trial, which is the best scientific evidence. We have folks who do basic science research. They work with mice and they work with test tubes and they do that kind of research. The kind of research we're doing is called social behavioral. It works with groups of people and attitudes and actions. And so that's an area I'm very comfortable doing, and in evaluations of educational programs in particular.
Awesome. So John, in your career, you have had a lot of success. And I know with a lot of success and the path that you chose to be where you are, it doesn't come without difficulties. And just as a man who's made it so far and in such a great position, and we really applaud you for coming back to help the community, which is absolutely amazing. Can you touch on what type of difficulties occur in this type of research? Because there's going to be some difficulties in anything you do in life, and especially something so big of this magnitude. And when those difficulties occur, how do you manage them and how do you help overcome those?
Yeah, thanks. You know, this project involves about 400 students who we'll be surveying. I have the good fortune of recently being the principal investigator on a team that got a grant from the National Institutes of Health to do 20,000 COVID antibody tests next year with 12 healthcare centers, 150 churches. So, you know, back to scale, this one is relatively small compared to that other project, and yet each of them require strong levels of trust, excellent communication. And so communication with that research team, there's about a dozen involved in this peak team project who are really key personnel. And then of course, communicating to the 400 parents. They need to know what's going on with their kids. Mm-hmm. And they need to have the opportunity to opt out if they don't feel comfortable or have their questions answered. How do we modify our approaches, listening intently to what the parents and the youth want, and modify our survey instrument for the next cycle, as an example. So that communication, and of course with the scholars we need to communicate as well, it can be both challenging and rewarding. When we start to see people understand why and how and they value what we're doing, that's very uplifting. And of course, if they give feedback and we need to change, then we adapt and adjust and respond so that people can get to the truth in our discovery. So one other part that's going to be challenging for this kind of work is how do we encourage 400 scholars to voluntarily respond to a survey when we're not giving them any financial incentive. We can't get together for a pizza party even afterwards because of COVID.
And because JP ate all the pizza.
It was good. But you know, that's going to take a few weeks. So we'll start it and maybe a few will do it out of the gate, but then a week later the teachers will remind them, and applaud those who did it and only do it once, and then encourage others, and then one more week later we'll bring it up. But at some point we have to freeze the study and say we've tried enough. There's folks who just don't want to do it. They've got other priorities in their life. That's fine. But behind it all is those trusting relationships with the teachers, promoting it appropriately.
And that's something I really applaud everyone that's working on this, is the trust factor that you say. I think the individuals that we have that are involved in this, they are so great at building trust because of their passion. They're not just doing it because it's something in their job. They actually really want to do this and want to learn. And I don't just say it because he's here, but JP is someone who I can always use as an example. He's always wanting to be a difference maker. He always wants to build with the kids. And when I come in the trenches a few times, I just see how comfortable the kids are with him and their passion of wanting to work with him as well. He ignites a lot of trust in them, and they want to help them. Also the MAS teachers that are involved, just listen to them talk about how important the kids are to them, especially during COVID right now. They're just reaching out to them, making sure things are good. That's important. So I think the people that are involved are very, very key, like you've said and touched on. So I feel very confident in the group that we have and the resources that we have.
Man, Hassan, thank you for those kind words. I'm gonna compliment you later on this.
Make sure you give me my $15 on the side, okay?
Yeah. I want to motivate some of business leaders who are listening to our peakcast right now as well. We have the private sector, public sector. We have a charter school, Moore Academy of Science, a nonprofit, Strive, and the Medical College of Wisconsin. Different parties coming in to collaborate. I want to motivate people who want to think outside the box. How can organizations benefit from these research findings? What are the pros to completing this and running a successful IRB?
Well, after we do the 3 surveys and the 3 cycles of surveys and the 3 or 4 focus groups, we plan to write a scientific manuscript with the results of the surveys and focus groups for our local stakeholders and a national audience. We're going to use the information to respond to the students' needs, to continually improve the PEAK team program, to seek additional funding, to offer the program to other schools. And when we publish and present with different audiences who are interested locally and nationally, we're hoping that there's other grantors who can fund PEAK team, that other schools can participate, and other communities can replicate the approach that we're using. So, that's our hope, is that we learn from the experience and that we can grow these kinds of approaches to benefit youth and families who experience trauma often in their daily lives.
And that sounds like, from that solution, it sounds like everybody who's participating, it's a win-win for everybody. And so, that's why I like to wake up every day, because, we're working for a greater cause.
Yeah.
So I'm excited.
So John, I'm gonna put you in a situational question now, okay?
Okay.
One that I don't know if you're ready for, but I know with your answers, you've been very quick and efficient with, so I know you're gonna do well. So give me a time where I'll go into explaining what the concept is. So we use a concept here at Strive called COPE. So we're going to call this cope it out, this situation, okay? It's going to be cope it out. COPE stands for communication, offering, positivity, and empowerment. A lot of leaders such as you, JP, Dr. Curry, all these people that are leaders, they go in situations where a lot of times they have to help their peers or the individuals around them, whether it be a team or just someone that they're constantly around. Give me a situation where you've been in where someone has been very stressed out or feel like they can't do something, and how you used one of these letters in COPE. Once again, communication, offering, positivity, or empowerment, and how you used one of these letters to help them through their stressful situation.
Yeah, Hassan, I use the COPE approach in all 4 in my regular activities. I direct an Institute for Health and Equity with 100 faculty, staff, and students. And we have established together a shared mission and values. So that becomes really foundational when we face challenges, whether they're individual or as a group. And so I like to think about that positivity as every challenge can be framed as an opportunity. Um, and also, if an individual in our team is experiencing challenges, sometimes that I'm responsible, but a lot of times it's what can they do with their ingenuity, their innovation, their thoughtfulness to solve that problem. So a lot of times it's just listening intently, asking the right questions that helps them to solve the problem, which in effect allows us to solve the problem together. Um, and to be very resourceful. You know, we live in a community of abundance. We don't know all the answers, but at a place like the Medical College of Wisconsin with 6,000 employees, we got a lot of talent. And we live in a community that's got amazing resources and skills. So if within our group, we can't come up with the solution, who else might have it for us? And that could be something like doing a quick search online or making a phone call to somebody we know has dealt with those kind of issues and can help us solve the problem. So not a specific example, but those are guiding approaches where I use COPE day in, day out.
That's awesome.
That's great. All right. So we're getting to the end of the peakcast show. So this is your opportunity, John. We like to call it Shout It Out. You have 30 seconds to promote anything you want, anything you guys got going on at medical college. You know, shout out, you know, any family member or anything you want. You have 30 seconds. Are you ready?
I'm ready.
All right, here we go.
Well, thank you first, JP and Hassan, for this awesome interaction. And I've really enjoyed working with Brandon and Paula at Strive 365, with Anthony McHenry, the leader at Milwaukee Academy of Science, Tresca and Mr. Bodwin and Rooney. They've been awesome. Great partnership. And I have Tom and Rodney, my biostatistician collaborators. And today's my birthday, so I'm particularly grateful to my wife and son John and daughters Tessa and Alyssa for connecting with me virtually. One's in Madison, another in Denver. And we're going to have some fun celebrating because family's first for me, and work is an important second.
That's awesome. John, happy birthday. We did not know that. Hey, we got to send you a cake. And for your birthday, you went over 30 seconds, but I gave you like 50 seconds because it was your birthday. So
Thank you.
It's his birthday. Well, happy birthday, John. And thank you for coming on and doing this on your birthday. So that shows, guys, if that doesn't show you what passion is, I don't know what to tell you, because if he's willing to put aside his birthday and be here and talk to two guys like me and JP, no one wants to talk to us, even each other. We really appreciate you coming on and giving us all the insight. And John, one thing I just want to end it with. So for a lot of people, they get shied away from opportunities that you talked about. And I really like that word you use, is opportunity. The last thing I'm going to ask you is, what do you say to those people that are afraid or just don't believe that they can participate in making a difference or doing something like an IRB? What is the message you say to them, and how can they do this?
Yeah, I think it's important to believe in ourselves and to be surrounded by people that give us encouragement and positivity and support. Not every kid has that. Not every adult has that. But baby steps, don't start with something huge. Start with something small that's a change, as we've discussed. Trying something new. We learn from mistakes, so that's inevitable. And yet, when you get the joy of things working out, that keeps you coming and saying, I'm going to take on something a little bigger. And before you know it, you'll become the role model that you never thought you could. So I think support systems and giving it a try is where it starts.
Awesome. So I hope you guys took away a lot from John, sharing a lot about his experiences and how important this IRB is to not just the community, but for these kids just individually, how important it is and how it's going to make a difference. And also just making sure that they trust what we're doing and We're there for them. We're not doing this for any other reason except for their own well-being and benefits. So thank you to individuals like John, Dr. Curry. Paula, I didn't forget you, even though John beat me to saying it. Paula has done an immense amount of work making sure this has worked as well. So thank you, Paula. Thank you, JP. Thank you, Anthony McHenry. My good friend, Joseph Wilkie, Tresca, everyone that's been involved. Thank you guys so much. And you guys, really hope you take away a lot from this. This has been one of the most influential peakcasts that we've had. So Strive 365 coming to you all the way live. Take care and enjoy.
Thank you. It's been great to
You
spend
guys.
time with you.